Safika binti Widin. A new Straits Times newspaper cutting in 2021 entitled Higher Tobacco Taxes Can Benefit Health Economy. Malaysia has spent about Rm 15 billion, which is 1.7% of 2012 gross domestic product on tobacco that related to the healthcare costs. Despite the evidence of significant potential positive equity impact on smoking, if tobacco prices are increased via taxation. Malaysia's last tobacco excise tax rate increase was in 2015. Tobacco taxation is an essential component of a comprehensive tobacco control strategy. The benefits of tobacco taxation are threefold. As the abstract from the newspaper cutting has highlighted the 3 points to support the statement, which is the first one is tobacco taxation can reduce smoking prevalence through the change in smoking behavior. Second, taxation can correct negative externality in the tobacco market, like the negative impact of second-hand or even third-hand smoke, loss of worker, productivity, and the burden of associated healthcare costs. And third, more government revenue can be generated by the increasing tobacco taxation. Therefore, attention should be given to the effectiveness of taxation. Malaysia is a party to the World Health Organization Framework Convention on Tobacco Control that require the country to sign on the implement the requirement under the convention. The convention requires the country to implement demand and supply reduction strategy. This is one of the way of demand reduction is by the increasing the price by the way of additional tax. Increase of price of tobacco product has been proven numerous times to help to reduce the demand, adding that the price increase will also help for the low-income groups to stop smoking. Also, this newspaper cutting also highlighted the causes and the way to overcome a tax is the main strategy to implement to reduce the issue. Significantly increasing the cigarette taxes result in fewer kids that starting to smoke and in more adults that quitting, while at the same time providing substantial revenue to fund the important health as well as tobacco prevention program. For instance, every 10% increase in the price of cigarette reduces consumption by about 4% among adults and 7% among youth.
Moving on towards the issue of this article, it correlates with two chapters, which are Chapter 3, entitled The Economic Basis of Government Activity, more specifically on negative externalities, as well as Chapter 6, entitled Taxation Principles and Issues, touching on the topic of excise tax. The article that we chose explains the issue of why the government should increase the excise tax on tobacco-related goods to reduce negative externalities as well as high healthcare costs due to tobacco-related sickness, as well as to gain more revenue for the government. The first issue can be seen in terms of reducing negative externalities. When the production or consumption of a product results in a cost towards other third party, this is known as negative externality. The goods are harmful to society because they produce a negative externality. Companies manufacturing these tobacco-related items receive the economic benefits of selling its good, whereas the government and taxpayers bear the cost of health damage caused by the company. Moreover, smoking also imposes costs to others financially, as the healthcare costs of treating tobacco-related disease would have to be borne by taxpayers without differentiating them between smokers as well as non-smokers. This implicates public finance because the burden of treating smokers would have to be borne by non-smokers as well, raising equality issues that are the consequences of a certain lifestyle choice. Furthermore, smokers suffering from tobacco-related disease may be taking up precious medical resources such as hospital beds, doctors' time at the expense of other patients suffering from non-preventable conditions. In 2019, the Malaysian government had spent at least 16 billion to treat patients suffering from diseases due to their smoking habits. According to the Deputy Health Minister Datuk Lee Boon Chai, the amount of money was 4 times the excise duty on cigarettes collected by the government, which amounted to a total of around 4 billion per year. This, the government can expect to pay less on tobacco-related healthcare costs as there is less smokers purchasing the goods if they increase the excise tax on these goods. In addition, another theory that can be related in accordance with this newspaper article would be that it stated that imposing tobacco tax would increase government revenue. In Chapter 6, one of the objectives of taxation is to increase the government revenue. And that the government spent a significant amount of money on tobacco-related health issues, a higher excise tax on tobacco goods would allow the government to raise revenue from the public's expenditure on tobacco products. Thus, increased excise tax would result in fewer cigarettes being purchased, as well as lower tobacco-related healthcare costs such as cancer, heart, lung disease, stroke, chronic bronchitis, chronic obstructive pulmonary disease, or also known as COPD. In the case of lung cancer, more than 80% of cases have been found to be directly related to tobacco smoking. According to the World Health Organization in 2015, although the smoking trends among Malaysians have been slowly decreasing, the health burden has still remained high. According to the Malaysian National Cancer Registry in 2016, lung cancer is now the second most common type of cancer that affects men as well as women. Deaths from lung cancer could be avoidable by preventing smoking behavior. These deaths have been increasing from 1,122 men a decade ago to 1,253 in 2016, as well as 457 to 561 women. Considering the number of smoking-related deaths could be avoidable, from a purely public health perspective, there is essentially a strong need for the government to intervene in the tobacco market by increasing its excise tax. So that's all from me. Thank you.
Advancing to our next point, which is causes that lead to higher tobacco taxes by government are an increasement of smokers in Malaysia. According to National Health and Morbidity Survey 2019, 21.3% adults, which are aged 15 and over, or cumulatively 4.88 million Malaysians, smoke, with a larger number of male smokers. Approximately 30,000 fatalities a year are projected by 2020 if the current trend in smoking continues. According to the World Health Organization, 10,000 deaths are linked to smoking each year in Malaysia, which is the leading cause of disability-adjusted life years and lost years of life in the country. Despite a number of anti-smoking initiatives being implemented over the past few decades, various anti-smoking initiatives, including legislations, health promotion campaigns, and community outreach programs, have been launched and executed by the Malaysia Ministry of Health in an effort to lower the country's smoking rates. For instance, on January 1st of this year, all restaurants and cafes in Malaysia became smoke-free zones. That's why the benefits of taxation is important as it can minimize the number of people who smoke by altering their smoking habits. So another causes is an increasement of a second-hand smoker, which is the SHH. Doubly one of the factors that driven the government to fight tobacco consumptions. According to the Global Youth Tobacco Survey, which was done in 168 countries, around 47% of non-smokers are exposed to SHS at homes, and approximately 48% are exposed to the SHH outdoors, because nearly a quarter of Malaysians adults are smokers. SHH Secondhand smoker exposure to the Malaysian teenager is likely to be significant. This goes back toward the second point of the benefits in tax citation, which is then correct the negative externalities in tobacco markets regarding the negative impacts of secondhand smokers or even worse, the third-hand smokers.
Hi, my name is Nur Suryani. I will be talking about the how to overcome the intake of tobacco. So, in order to maintain the health of the people of this country for the long term, it is important that any substance that can invite addiction and health problem is given a continuous tax increase. It is one of the tobacco-based product which various efforts have been made by the government, especially through the Ministry of Health Malaysia, to provide exposure and awareness on the danger of smoking. Although various efforts have been made to curb the smoking addiction, many more are taking this issue slightly. So, coronary heart disease, which is CHD, has been recorded as a leading killer since 2007 in public hospital. So this statistic is particularly alarming as cardiovascular disease accounted for 24.7% of deaths in public and private hospital in 2013. More than a quarter, which is 38% of the patient with acute coronary syndrome (ACS) are smokers. So if this continues, the impact of tobacco cigarettes show that the government will have to bear the burden of treatment costs of 7 billion by 2025. So therefore, measures to increase the tax on tobacco-based products are implemented. If the cigarette tax is raised, of course the price will also go up, and if the price of cigarettes goes up, the individuals involved will start thinking many times before buying a pack of cigarettes. So the move is to put physiological pressure and financial burden on those who are addicted to the use of tobacco, which the items that are harmful to the health. So this can also reduce the prevalence of smoking through changes in smoking behavior. So in the long run, smokers are more likely to quit smoking. So with this, the tax proceeds collected can be used to fund the smoking cessation effort, including providing nicotine replacement therapy, medicine as an incentive to the smokers. So next, by curbing the entry of smuggled cigarettes on a large scale to ensure the effective implementation of this tobacco tax. Based on the Malaysian smuggled cigarette study, ICS 2018, the scenario will result in Malaysia which losing up to 5 billion in uncollected tax revenue a year. Malaysia currently ranks at the top of the world on smuggling cigarette market with 58.9% local market share, or about 12 million contraband the cigarettes sold in the country. So citing from the ICS study, the sale of the illegal cigarettes is more widespread in Sabah and Sarawak, so as well as the East Coast state of the peninsula, with the latest scenario reaching the highest the level of 80% and 70% respectively. So this critical situation can only be addressed through strategic and continuous level of enforcement in curbing the supply and demand for illegal cigarettes. So the managing director of JK International Berhad, which is Cormac O'Rourke, stated in a press conference that more effort and collective approaches between agencies need to be intensified, even though the Royal Malaysian Customs Department is the responsible for enforcing the entry of the goods at the border. In this regard, among the proposals implemented by the government to curb the aggressively entry of the illegal cigarette is that there will only one entrance to the country is allowed for the importation of cigarettes. So the goal is to avoid manipulation of process and procedure. So this allows for better focus and monitoring the cigarettes imports into the country, as opposed to the ready practice of cigarette transfer taking place from all entrants, which were apparently manipulated by the smugglers to smuggling the cigarette. This is also to address the sale of the illegal cigarettes and ensure that the prevention of cigarettes smuggling is implemented comprehensively. Thank you.
Issues such as in terms of reducing negative externality imposed costs to other financially. Thus, the finding also relate with the theory due to the imposed tobacco tax will surely increase the government revenue. Also, from the finding come with several causes, such as it lead to the higher tobacco taxes by the government and increasement of second-hand smoker. Next is the finding of the ways to maintain the health problem by imposed taxation such as the entry of smuggled cigarette on a large scale to ensure that the effective implementation of tobacco tax. As a final conclusion from the newspaper cutting, a tobacco tax or cigarette tax is a tax that imposed on tobacco product with the state goal of reducing tobacco use and its related harms. Due to the price inelasticity of demand for addictive products such as tobacco, these taxes have a relative small effect in reducing tobacco use, and also government play an important role to make it happen. Thank you.